All right. I had to
All
hit.
right. Well, good afternoon, everybody. Welcome to the Dow Jones News Fund, Center for Editing Excellence, and Ed Trace's class. What do you call your class, Ed?
That's what we call our class.
So we're
Center
both the
for
Center for Editing Excellence.
Yeah.
All right. Well, we've got an awesome speaker this afternoon for everybody to hear. Nicole is a senior communications officer with the Robert Wood Johnson Foundation, and she funded by the Robert Wood Johnson Foundation. Thank everybody for their support. Yay! Is here to talk to us about health equity for journalists. And so we're going to turn it straight over to her so that she's got all the time. So Nicole, thank you so much for being here today. And it's all you.
You are very welcome. Okay. So Nicole Bronzan, I am a communications officer now. I used to be a journalist. I want to start by just acknowledging that I'm old, first of all, but 20 years ago, this week or around this time of the year, I was actually in Dr. Trace's class at Temple University. So, you know, the circle of life, as they say. I'm going to just briefly talk to you about the Robert Wood Johnson Foundation and health equity. I will tell you about why that matters for journalists and give you some examples, and including some of the work that I do. And then we'll open it up for questions. And I just want to start by saying that, again, I started as an editor. I was placed at the New York Times in 2000, ended up coming back there. Yeah, that's right. Came back there the next summer. And then they hired me, I think a year after graduation, they hired me as a staff editor. And so I was 23 years old coming to New York City and, you know, editing people who were 3 times my age. And did that for, gosh, 7 or 8 years, and then moved over to communications. So I've been in communications for a while. Probably the organizations you would know best, Freedom to Marry, which was one of the campaigns that won marriage equality, and ProPublica was most recently where I was as communications director before I came to the Robert Wood Johnson Foundation in 2015. So it's been almost 5 years. I just want to say that for all of you out there, it is not an easy time, pandemic aside, to be a journalist or to be just a young person trying to get out there in the world. But I just want to say that I have used my journalism skills in every job I've ever had, from, you know, waiting tables in college to now doing what I do in communications. So you shouldn't worry about that. There are lots of other things to worry about. But anyway, we'll jump in. So first, let's talk about health equity. Where I work, the Robert Wood Johnson Foundation, we really focus on this idea that health is not just about your genetics and your access to doctors. It's about that, but it's also about so many other things. And the foundation really does this through funding programs, through, like in this case, funding journalism to keep this conversation going, funding research, not so much the sort of medical research you might think about, but research about, for example, the different areas of our lives and how they affect us and our health. If I were to explain to you what health equity is, we first need to start with equity. And in America, we often talk about equality. So one of the first projects that I really did at the foundation was to distinguish between this very American idea of equality and equity. So equality is we all get the exact same thing. Doesn't matter if it's big enough or small enough, or if we can even get on it in the case of the woman in the wheelchair, right? But everybody's got it, and that's that. Equity means you get what you need. It's what's fair. It's what sort of evens the playing field. That's what we want in health equity, is we want for everyone to have what they need. One other way that we try to illustrate this is on social media. You can see here some of the sort of examples, but you know, economic security, I think we talk about transportation, schools. So all of these things are about health, jobs, yes, access to quality healthcare. All of those things impact your health. And in fact, the estimates I've seen have varied, but as much as 80% of your health and your sort of quality of life is actually due not to medical care and your genetics, but to these things we call social determinants, which are things like transportation, education, et cetera. The national conversation has shifted a lot in recent years to talk about equity a lot, and I think that's a really good sign, and it's some of the work that I'm doing as well to get that out there. We'll talk a little bit more about that later. But the real piece for me that I think we're focusing in on now is this idea that there's a reason things aren't equitable. And in this country, it goes way back. And it's important to know, you know, if you see a statistic about Black people being 3 times as likely to die at this age, or, you know, Black babies, or you know, sort of Native Americans with depression. And you really need to sort of unpack that. So that's what we try to do here. And I'll just give you a little example of one of the things that, another thing I've worked on actually, but there are other people that work at the foundation, I assure you. So we have these series of maps on life expectancy that we worked on with VCU. And I think there are 20 or so of them, and they focus in on metro areas and just looking at literally when you are born in this area, what is your life expectancy at that time? As you can see, it can vary a lot. So in Richmond, Virginia, up in the area of Brooklyn Park, you see 70 years. You see as much as 83 years on the lower left in Westover Hills. Then you see this tract right in the center there that's 63 years. So you're talking 20-year difference in just a few miles, right? That's pretty extreme. So keep your eye on the red and the yellow, and I'm going to show you a different map. This map is from redlining in the 1930s. And if I could see you all, I would ask you how many of you know what redlining is. But generally speaking, I would say probably 30 to 40% of the people I talk to about redlining know what it is. Some people know what it is and say, oh, but that's over. That happened in the 30s. And the answer is, well, in some cases it's over, but the effects linger. In other cases, it's really not over in a lot of ways.
Yeah.
But redlining really comes down to a practice the federal government undertook to actually say, these neighborhoods are safe for lending or desirable. These neighborhoods are hazardous. And so banks actually weren't making loans here. So I'll just go back briefly so you can see that. So the red right in the center there, that's that same area that was redlined, where people were told, like, this is not a good place to be. And the banks didn't invest. And a lot of times when you see these maps, you'll see highways that go right through those neighborhoods that cut them off from the rest of the, all the resources, the good schools, the pharmacies, the healthcare, all of that kind of stuff. So part of my job is to really unpack, yes, there are inequities, and those have reasons. They have sort of roots in our historical upbringing here in the United States. So we're trying to shift the conversation. The other piece I do is not just looking at the bad stuff and the problems, right, but shifting it over to what we want to see. So sometimes people get really, really sort of overwhelmed when I tell them all these things about health equity, and they sort of feel like, what's the point? I can't change any of this. It's so big. So we want to show you that it's actually not true. We can change it. So we're trying to change that conversation from the problems to the solutions. Yes, talking about deficits, but also about opportunities, and then moving from despair to what we hope is hope. And that's the fun part of my job. Some of that does include working with journalists, and I'm just going to give you a couple of examples here, also to segue into why this is important for you. You know, as I said, we hear a lot, I think, especially in the past few years, about especially with infants and mothers. We hear a lot about Black babies dying early. Black babies are actually twice as likely as white babies to die before the age of 1. We're hearing that so much more, and that's great. What we're not hearing is the why, and we're not hearing that even when you control for things like income and education, that's still true. And I'll just share brief tidbit, because I think it's helpful to just bring this home. So I had 2 premature births. And I was, according to all my doctors, I was in perfect health. I run half marathons, and I eat really well, and I've never been overweight, and and I'm educated, and I have a great job, and I live in Princeton. And there's no explanation for why this happened to me. And when this happened, I wasn't working in this field yet, and there was never this sort of discussion about all these other stressors that affect all of us, really, but particularly Black people and other minorities in the country. So it's great to see the coverage we saw here on the left in the New York Times that really called that out. And then on the right here, you can see a sort of a smaller version, really talking about disparities in Topeka, and how that conversation was actually driven by one of the products we released called the County Health Rankings. And the rankings is really a way that we try to focus in on, all these factors that contribute to health, and why that sort of matters. And when you start to see, counties that are ranked at the top and why, and counties that are ranked at the bottom in their state and why, you can have those conversations about access to all those things we talked about. The year after that, actually, we talked about housing in the County Health Rankings, and you can see this one, where really we are, again, it's not just a story about this community ranked higher than this community. It's a story about why. You know, this is important. Housing is important to health. And we actually had a quote in here, so that was kind of cool to be able to get that sort of sense of why this matters. I wanted to throw this. This is actually my new slide. This one is sort of contemporary. So when coronavirus started really wreaking havoc in the U.S., one of the things that my team did was say, well, you know, what are the resources that we have that can help journalists right now? And one of those resources was actually a sort of cadre of researchers who we promote, who talk about these very things, who study the ways that access to housing and income and all of those things affect different populations. So we actually started a series of briefings for press that focused in on the coronavirus and how that was actually sort of how all of these sort of background factors that we talk about were actually playing out in the coronavirus sort of world here, this new world we live in. So I just want to point out the quote here. This is from the researcher that we have. You know, there's evidence that stress like that caused by racist abuse can weaken an individual's immune system and make them more vulnerable to contagions like the novel coronavirus. So this guy is somebody we fund to do some of this research and to specifically talk to journalists. So we held a briefing. This was our first one, and we focused on Asian Americans for obvious reasons, and got a ton of stories, and not just in the Times and the Post. And, you know, we really, you know, South China Morning Post, you can see. We had stories from teeny tiny papers in the Midwest and the Southwest. And we've done now, I think, 6 of these. We focused on first Asian Americans, then we focused on minorities, and then specifically Black Americans. We talked about child opportunity, rural, Hispanic Americans. I think we have a couple more coming up. We're going to talk about disability as another one, but trying to see through this lens how all of these things that are always there in the background really come to play out in a crisis like this. So that brings me to some tips for you. And they're very simple because I think this is actually, there's a lot to learn and there are a lot of facts, but the principles of really reporting from an equity lens are 3 things, I think. Number 1 is who is most affected and why. And again, that question, it's not just, oh, well, because, you know, Black people in this country are more likely to die early. That's just how it is. No, actually, there's something behind that. You know, why are disabled people overall less than half as likely to have, you know, stable income? The second question then is, are their voices being heard? So in your reporting and in editing, I mean, that's certainly a question you want to ask, that are we really focusing in on not just what happened, but why? And are those people being represented in some way? And then how can we, of course, as I was saying before, move from just the problems into some frame about solutions? You know, who's doing the work, who's making the change? The Solutions Journalism Network does this really well. I think a lot of national media are actually doing this really well now. And it's, so when I was at the Times, I'm sure this is still true, but we always like to say, because I was on the Metro desk, you know, the big sexy stories were always the really, really dramatic ones where, you know, all these people were in danger or there was a huge fire, and we would always say, if it bleeds, it leads. And that was true. You know, it's going to lead the page if it's this big disaster, right? But we need to move away from that too and talk about the good stuff and talk about the progress that's being made. So that's sort of the third bullet point. And that's really it. I just wanted to give you a brief overview. I'm happy to answer questions about health equity, about the foundation, about my journalism experience or my life or anything like that. I know it's a strange time, and I just really can't even imagine being where you are. So anything you want to ask me is totally fine.
So this is where you guys got to jump in and ask some questions.
And is this by chat, or are they actually gonna speak?
Let's see what happens. This is my first time
Okay.
on the webinar too.
Okay.
You can ask in the chat, or you can say you have a question and I'll turn you on.
I'm just gonna make sure I can.
Gary has asked a question in the Q&A.
There we go. I got one from Sophia Austin. Sophia is asking, what are some of the best places to look for related to health equity during the COVID-19 pandemic?
That's a great question. I will say the one that has impressed me, and not just because I used to work there, is actually ProPublica. They've done a lot of stories about, just kind of digging into this stuff. And there's one in particular about the difference between the sort of West Coast and East Coast response, and how that, in no uncertain terms really, meant thousands of lives on the East Coast that could have been saved. Trying to think who else on coronavirus specifically. I mean, I think, to be fair, the New York Times and the Washington Post have done great stories. I'm actually seeing some really, really good stories coming out of the local papers. I think it's, I think we tend to, especially as young journalists, be impressed by the big names, but sometimes the local stuff is most important. So I would say wherever you are, you should be looking around and seeing what's going on there. And that's the other thing too about coronavirus that's so interesting, is that it, yes, it is this national emergency. It's this international emergency, really. But the stories themselves are really dependent on where you are. So I'm in New Jersey, where we've had the second highest number, basically almost since the beginning. We've been a hotspot. And so the reality for me and for, my family is much different than it is in, New Mexico. So that's another piece to look at. Here's more coming in here. So how do you be mindful of vulnerable communities while covering them? For instance, not violating their trust. That's a really, really good question. So the thing that you don't want to do, obviously, and let's see here, who asked this question? I'm trying to actually say names here. So Mina, you already are conscientious and know that it's really easy to focus in on a community in the wrong way, which is to kind of gawk, right? The key to that, I think, is, again, making sure that the people you're reporting on are represented in the reporting. So it's not just, oh, I talked to the mayor about this horrible health number that you guys have. Like, oh, I talked to the mayor, or, I found some Joe Smo on the street who fit all these demographic characteristics. But rather, are there groups, and there usually are, who represent, underserved communities? Are there, in some cases, national groups who can put you in touch with local groups? One of the benefits of reporting and editing where you live is that you have a sense of that stuff. And I mean, I remember in New York, I guess it was maybe the last 2 years I lived in New Jersey, but so much of the questions that I would ask of my reporters was like, I know this stuff. I lived there. I lived in Brooklyn, and I would say, well, what do you mean, that this flag was flying there and this person said this? Like, say more, because last time I was there. And that's really important. The other thing, honestly, is also, this is just a testament to, I think, diversity in all ways of newsrooms and news gathering operations, that, you want to have people who actually have lived experience, so that it's not this foreign thing. And I'll give you a quick example. I forget whether it was 2001 or 2000 when Aaliyah died. And I was at the Times, and it was the summer. I was an editing intern, and I'll never forget, I started in my networks, I started hearing all this buzz, and people were just going crazy, and there was this outpouring of grief, and the Times was completely oblivious. They were like, oh yeah, okay, put that in the art section. They had no idea how big a deal this was, because they didn't have people of color and young people, at those tables. And we ended up having a front page that completely missed it. And then I think the next day or the day after, they got it. And we had a big story in particular about her funeral. And I mean, she, everything was happening in New York, so we were right there. But it was a great example of sort of missing the story because you don't have you almost like have your blinders on because you're not that person, right? So that's really important. Okay, Gary asks,
Nicole,
how do you share your personal? Yeah.
We skipped over
We
one.
skipped Tiffany back here.
did
She
we?
has a really good question for today's world. How can we do solutions from home? How much of that requires being out in the community?
That's a really good question. Now remind me, this is a combination of two classes, right?
But they're both editing interns. They're
Both editing. Oh, it's four? Wow. Okay, that explains why there's so many people overseeing this. Okay.
53 people.
Yeah. So that's really tough. And I think there's kind of no way around that. I would say, knowing what I know now about reporting and also about health equity, I would just say, thank goodness for Google, first of all. And also, you shouldn't underestimate the the willingness to help and the real desire that a lot of journalists who are out there now have. You know, when I was, oh gosh, I really am old. I was going to say when I was coming up in journalism, you know, you couldn't tweet at your favorite journalist. You know, you couldn't even call them up, right? And now you could DM somebody and be like, hey, how'd you get that story? Or who's a good person to talk to? One of the things I like to do on Twitter especially is make lists of people who cover certain things or have interests and expertise in certain things. And I just start to follow them and engage with them. And this doesn't have to be big names in journalism. I mean, I know a guy who is a library scientist in North Carolina, and I met him in this really weird way at a conference. And he's like my library guy now. Like if I have a library question, I go to him. And I follow him on Twitter. And it's just one of those things where every day I'm like, let me click, click, click. So I would say, you know, firstly, make sure you're just connected however you can be online. And that just means engaging, right? It can be as little as a like or a retweet or, you know, a comment in there. I would say, you know, read up on everything you can about whatever community you're covering. The other thing, and it used to really annoy me actually, but it's become so commonplace now. I feel like around, I don't know, 5-10 years ago, it started to be a thing that journalists, especially radio and TV, would have on the show print journalists as sort of experts. And I was always like, what in the world? What is this? You can't do that. You can't just call, you know, the guy who works next to you in City Hall and be like, hey, talk to me about this. But I will say that I think sometimes if there's somebody who's really covered something well, and I'm thinking back to I had a colleague at ProPublica who covered the TurboTax. I don't know if you all are familiar with this, but the TurboTax scandal where they were essentially charging when they shouldn't have, and there was all this sort of shady stuff going on. But she was the go-to person like in the country, and everybody knew it. So if they had a story, if you know Jon Stewart was going to do something, she'd be on. So it was one of those things where it actually does sort of make sense to sort of cultivate a cadre of experts that you can call on. And I will say, and I've done it too, people reach out to me and say, you know, I have this report and I don't know where to start. And I'll say, you know what, I'll give you a few tips. So don't be afraid to reach out. And then I would also say your professors know a whole lot, and don't underestimate that either. Some of them have been doing this for a long time. And one of the ideas I think that we are sold very early in journalism is that this is all about competition and getting the story first. And, you know, you have to sort of, and I just think, I mean, I don't think that helps us. Yes, you want to work hard and do your best. But I also think that has shifted a lot. I mean, just think about in the past few years how we've seen journalists, you know, from the White House to even, you know, reporting on certain sort of national crises, working together and acknowledging that this is about the public good for all of us and not about, you know, who got the story first, which is not to say there's not competition there. But I say all that to say, I know I could count off 20 people, 20 journalists I know who would be happy to spend 5-10 minutes just telling you what they know and how they got there. So, but yes, it is very difficult. I can't even imagine trying to do this from online.
So speaking of that, Nicole, our next question is from Gary, who asked, can you share a personal story of success? And I apologize if my dog is barking in the background.
No worries. Luckily, you'll hear neither my dog nor my kids because I'm on the 3rd floor of my house. My story of success, gosh, I don't know. I mean, I was and am a very good editor. And that's something I never would have known going into journalism school, that I would have been an editor. Certainly taking the Dow Jones editing test, you know, at 19 years old or whatever, I did not think, you know, woohoo, I'm a big shot, I'm going to end up at the New York Times. But I think, you know, that was sort of the beginning. And what I've learned more than anything in all the jobs I've been in is really the power of smart sort of common sense thinking. And with that, I mean, just asking questions and just sort of at every turn thinking to yourself, does that sound right? Or, you know, is there sort of a better way at this? And then I think the next piece, especially if you are an editor, is figuring out the way to go back to the reporter as a team, right? And not like, hey, you really messed this up, let's fix it. But rather, hey, you know, I was reading this and I got a little confused here. I'll give you an example. Gosh, it must have been, I remember where I was sitting in the time. So I think it must have been like '07. I came across this series of stories that was focused on this sort of impending shift in our national demographics, right? And I think the numbers come down, but it was like, by 2050, we'll be majority minority, you know, and then it's come down, it's like that 2040, 2030, whatever. And there were all these stories saying, you know, by this time, you know, the majority of people will not be white or will be non-white or whatever. And I just kept reading it and I thought, this isn't right. Like, something's wrong here. And I finally realized what it was, which is, why are you identifying people by what they're not? Why are we talking about that? The story, if we want to make the story about what it is, the story is about white people no longer being a majority, which is fine. Let's talk about that. But it's not about this whole other group of people who are all different, but they're not white, suddenly being a conglomerate that's bigger than whites, right? And tell this to the guy who's been covering demographics and census data for 30 years, right? That he needs to rewrite his story, and you're 25, right? Like, yeah, that's fun. But I just called him up and I said, look, I get where we're going here, and I don't think the data, our reporting on the data isn't going to change, but I think the frame here is wrong. The frame is a white, non-white frame, and that's just not where we live anymore and not where we should be living. Yes, white people are going to be a minority, or at least no longer a majority, right? But non-whites are not a thing. That's not, you don't wake up I'm not a non-white woman. That's not how I wake up in the morning, right? And I think, you know, my boss and the reporter and all the other editors who had seen this before me were like, that's a really good point, you know? And again, it was partly the lived experience of my saying, like, this is not me. You're not talking about me here. It was partly the way I did it, which was to say, hey, I'm telling you how this came across to me. I think there's a better way, and here's my proposal. And not, how could you write this way? This is so offensive, you know, how dare you? That is not the way to win any friends. So I say all that to say that a lot of it is about, yes, being smart, and yes, asking the right questions, but also remembering that you are a team, and it's really important to have that rapport, right? And I mean, I can recall tearing stories up, and, you know, and again, people twice my age, and just saying, you know, hey, this doesn't seem like the lead. The lead seems like this, and, you know, this right here, you're kind of, you're hinting at it, but you're not giving it to us yet. And really, this is better. And people sort of not always liking it. That's true. But at least being able to have that conversation. So that carries through today for me. I mean, every job I've ever had, people have said, you know, oh, you know, she's super smart, but she's also really diplomatic. Or Nicole knows how to say anything. And I think that's true. It's like, I really believe that there is a way to say anything that you need to say in a not only civil, but sort of caring way. So that's what I've used. There are a lot of smart people in the world, and a lot of really talented people in journalism and beyond. But that's a skill that a lot of people don't have. And I think it's kind of silly. It's a soft skill, right? But it's really important, actually.
And Nicole, could you just tell us where you went to school, undergraduate and graduate school? You did.
Yes, definitely. So I'm a rattler. I went to Florida A&M University. And that was not a place that, you know, sent a lot of people to the New York Times. But I think there were actually two of us, at least before I got there. I think I was the second. But yeah, it was, you know, HBCU had a great journalism program, and I had frankly not really seen myself there before I even knew much about it. But yeah, it catapulted me into a new realm I hadn't even thought of. So that's also really important too, because you're also, you know, depending on where you are and where people come from, you're going to be surrounded by people with lots of big Ivy League degrees and multiple degrees. I have a bachelor's, that's it. I have toyed for a long time with going back and getting an MBA, or even getting at this point an MPH. But you know, I'm doing okay for myself. And I think again, it's about sort of using what you know and really you know, always sort of looking for the next thing that makes sense for you. All right, the questions are building up here.
Yeah, Sam.
Some good resources.
Sam Nelson's next. Can you see his Sam Nelson's?
Okay. Good resources that can help reporters determine health equity locally. Oh, it's a great question. So we have a bunch of resources on our site, rwjf.org. there are so many different tools now that can show you about, so the one I mentioned before, county health rankings, which talks about all these different, high school graduation rate, teen pregnancy rate, levels of smoking, like it really sort of gets down to the county level of that. There are some tools the CDC has worked with us on in the past few years. There's the USA LEAP project, which actually gives you that data down to the census tract level. And again, if you Google any of these, you'll find them. USA LEAP is LEEP. 500 cities, which is the 500 largest cities, gives you that sort of take. And actually also has a cool comparison tool where you can say, what are cities like mine in terms of demographics and size and all of that. Trying to think of some that are not RWJF. Let me think about that, and I can actually send some more stuff. But there really, if you were to just Google whatever piece of data you're looking for, you're going to find resources out there. The life expectancy stuff that I talked about is also on our website, and I'm happy to send any of those links to you guys. I'm just making a note here.
But while you're making that note, you can multitask. I'll throw in. I'm going to skip a couple because we're watching time here. But
Sure.
Sam asks, do you have any advice for journalists who do not necessarily have a medical or scientific background to accurately report on early studies and trials aiming to combat coronavirus?
That's a good question. So I think, again, in medical reporting, specifically in science reporting, it does feel like, yes, it's really helpful to have that background, more so than, oh, I'm on Metro and now I'm covering national. Like that's pretty much the same deal, right? But again, I would say that journalism is journalism, and you've got to get in touch with experts. You've got to make sure that whatever you're trying to report on is going to be comprehensible for your audience. And I used to teach a journalism like a editing 101, and I would always tell people, you have to remember that you're in this job for a reason and that you're a smart person. And so if you don't get it, then the people who read you are not going to get it either. So don't feel bad if you don't get it. Keep pushing and keep asking. So if you need help, if you're seeing reports you don't understand, again, I bet there are people on Twitter who are, PhDs who could, in 5 minutes, could explain this to you. I think more than ever, we're seeing a lot more, I don't even know what you'd call it. I guess I would call it almost like listicle journalism, right? Where you see like Vox and where everybody's like, 5 things you never knew about X, right? And those reporters have a very good lens on, some of them are scientists. The Upshot and the New York Times does, they have a couple of people who are PhDs. And in fact, we fund some of them too. But again, you can always find an expert. I think you have to just sort of deal with the fact that if you don't understand something, you need to ask those questions. But I do think the stuff specifically about the combating coronavirus it's especially tricky because this is an international issue. We've got some questions about who we can believe, right, in the international scene. But there are people who I think are good filters for this. And I don't know to what extent you all are doing sort of, local stuff versus national stuff, but any reporting that's already been done should be the first thing that you sort of look at to see, where do I go from here?
Then I'm going to sort of back up just because I thought the questions worked better in that order. Emily asks, as someone who has experience in the newsroom as well, do you have recommendations for sourcing and reaching communities disproportionately impacted by COVID-19 who may be historically undercovered?
Yeah. So this is again where I think, I guess when you say communities, I'm not sure if you mean sort of within a local place, you're trying to reach, say, the South Asian population or the disabled community, but wherever you are, I think it's pretty difficult, I would say, to have any kind of anything that's organized without some kind of web presence there. So if you're really looking, I think you'll find it. The other thing is to look for, and I don't know if you guys still have access to all the sort of databases and things, but if you look even within something that PR people use like Cision, and you look for the topics that people cover and the sort of niche publications, you could end up, I'm trying to think, there was this, gosh, this is really bringing back my editing days, but I'm remembering looking for, in particular, I think it was like a Vietnamese point of view or something about a story in New York, and we ended up sort of going through the niche publication that actually catered to them, and we said, you know, hey, we're looking for this point of view. Can you help us? And they were all too happy to do that, you know, without credit or anything. It's just sort of like getting that perspective out there. Let me see who else is undercovered. I mean, certainly if you're talking about national stuff, you know, there are basically, for all the things I can think of, you know, gender, sexuality, disability, race, ethnicity, there are sort of stalwarts in the national scene who sort of deal with that stuff and are very responsive. And I'll never forget, actually, I don't remember how this happened, but I was working I think I was working at the Legal Action Center, and which actually does a lot of advocacy, and ran into somebody on the train to DC who I had actually been in touch with. And I can't remember why she even knew me, but it was like lights and you know, bells and everything, because she was so excited. And I remember thinking, like, this is really interesting, because I'm not really anybody, you know, but it was just the fact that we had been focused on the issue and we had really, you know, paid attention and reached out. And that's the most important thing.
So let's skip down to Daniela. Daniela asked, how would you suggest presenting the positive aspects of stories rather than just leading with the problems and, quote, news that bleeds, while still ensuring readers will be drawn to those stories and will stick around to read them in print and online?
That is a question. So I think,
today, right?
you know, it's tough. I mean, especially in this atmosphere of, you know, how many clicks can you get and all that. I think it is tough to find what people are going to read. You know, I guess I want to just back up very briefly and say, I'm not saying that it's not okay to talk about the problem. You have to start there, because in a lot of cases, people don't even know about the problem. So you do have to start there, and it's okay to do that. But I think it shouldn't be the whole of the story, right? So let's say you're working in, I don't know, let's make it up. You're working in a tiny city outside Denver, and you looked at the county health rankings, and you see that your county is ranked, you know, second from the bottom in your state, and there are a couple of different reasons that seem to stick out. Among them, very high smoking rates, very sort of low participation in sort of civics among communities. Kids aren't graduating from college or from high school, and I don't know, STDs are high, right? So you could go out and report that story. You could say, this community has these problems, right? Or you could take, let's say, the biggest problem or the couple biggest problems, and you could do some research on what's being done in that area, right? And go to the groups that are doing that work. And instead of sort of framing the story through, hey, there's this big problem, you frame the story as, hey, look at the things we're doing to address this big problem that we have. And so it's just a slight tweak. And, you know, again, I don't think the reporting is that different. It's just the way that you frame it. It's the way that you write the story. So that's just a very quick example, but I think people want to feel good when they're reading the news, even if they're reading something bad. It's like, you know, I mean, I think all the time about these, especially the coronavirus stuff. I mean, it's just really, it feels very overwhelming. And I think people want to feel that there's hope. And even if that's just, hey, look at these nurses, you know, standing up for, you know, their fellow, you know, medical staff, and look at this community where people are sewing masks or whatever. It's like, yeah, the problem is coronavirus, but people are dealing with it in a way that's actually bringing out the best in our community.
So we've got two questions sort of back to back about your experience in the newsroom. The first one's from Sam. If you're following along with me, Nicole, I'm back to 221.
Yeah, thank you.
Do you have any advice on working with editors who may have different ideas about what's a worthwhile story?
Oh, that's hard. I mean, I've often been that. Yeah, it's like, I want to report this. No, I don't want you to report that. That's hard. I mean, I think it depends a little bit on the dynamics, honestly, between, you know, the editor and the reporter. But I will say that one thing that I always try to do with my reporters, and you know, it actually sort of ladders up, right? So I was assistant Metro editor, and I still had to report to my boss, who was the Metro editor, and he's had to report to his, so it all goes up. You have to keep sort of justifying yourself, right? So if my boss says to me, well, why is so-and-so working on that story? I have to be able to justify that too. So it's all the same is my point. And I think to me, the idea is, especially if you have an in somehow, if you have that lived experience. Oh, I'll give you a great example. So I had this reporter, he's actually now at the Washington Post, and he was covering Brooklyn, but he kept coming back to me with this story about the origins of the coverings you get on the dry cleaner the dry cleaner coverings. And there was this big feud apparently in that industry over this stuff, and it was based in Brooklyn. And I was like, Kareem, will you stop with this story? Like, I don't get it, just go do this other thing that I'm telling you to do. And he kept coming back. And finally, what he did was he just said, let me just give you 500 words of what I know and like how I would write this story. And he did it, and it was like, I don't remember if it was A1, if it ended up being A1, but it may have been A1 in the end, because it wasn't just a story about the coverings, the dry cleaner coverings. It was a story about these clashing communities and about this whole sort of underbelly of Brooklyn that some of us had no idea about. And again, that he knew about because it was his people, right? And so I think you got to be persistent, and you also have to be willing to go the extra mile, right? So this is essentially extra work that he did, right? Like, I had him on assignment and he was doing other stuff in his free time, and he ended up convincing me. So I guess I would say that, be persistent, be willing to do extra work. And the other thing is, once you show yourself in that way, and really show what you bring to the table, people are more likely to listen to you the next time around, right? To say, oh yeah, he had that really great story that time. And now it doesn't mean you're always right, because believe me, there were times with this reporter that I was like, what are you doing? But it's a push and pull, and it always will be. And I think that's what makes it good.
Sort of a related question to that is the next one from Molly. For young journalists being placed in a new community that they're unfamiliar with, how should they go about learning their community? In other words, how not to be a helicopter journalist?
That's a really good question. So again, I think this is a little different if you're sort of in the age of COVID-19 where you're online. You can't really just go places and strike up conversations and join meetings and that kind of thing. But I would say, sort of in the usual world that we hope to get back to, that's the biggest thing, is just to be out there. Find groups doing things you're interested in, ask questions, ask fellow people in the newsroom sort of what they do, who they hang out with. I think one of the things that I really liked about being a copy editor when I first started out was that I had my days free. And so I would do all kinds of things, and I didn't have to show up at work till 5 o'clock. So you should just be out there. I think in a similar way, I think online you can do that now. And again, try to talk to people. Trying to think of how to say this. You have to be able to talk to people and engage with people in a genuine way that's not always about a story, right? So you have to be able to say, I'm new here and I'm really interested in what you're doing. Could you have 10 minutes to just talk to me? And that can be hard to do, especially if you're not the most outgoing person, but that's journalism, right? And I think people know when you're being authentic with them, and they'll remember it when you come back. So that's it's hard. I mean, this reporting in the age of COVID is really, really hard. But I think that the same principles apply, which are like, you have to just be out there as much as you can. And then also, I think, again, sort of engage the alumni, of this program, of your school, how are they doing? What do they know? Who do they know? I can't tell you. You could name any specialty and say, find me an expert in X. And I bet you I have 6 degrees of separation from that person, right? I can just put out a call and say, does anybody know? So don't underestimate that either.
So I'm going to skip down a little bit and then I'll come back. What would be the best way, Caleb asks, what would be the best way to cover these communities and minorities in an area that is predominantly racially separated and a local paper? And I'll tell you, Caleb works for what we would almost call hyperlocal, rural Texas journalism.
Oh, interesting. So I assume that by racially separated, we mean that the area is very segregated, and
sure,
Oh, yeah?
Caleb, if you unmute yourself, you can talk.
Hey, can you hear me?
Yes.
Yeah, so my area is pretty racially separated, segregated. It's been that way for a long time. And I guess my question is just, how do you cover that without affecting both sides of it? Because a lot of the readers are pretty racist people. And I hate to say that, but it's true. So what would be your best advice for me, I guess, covering things like that?
So I have one follow-up question for you, which is, do you mean covering the segregation itself, or covering the community and the various goings on in the context of segregation?
Both.
Both. Okay. Wow, that's a curveball. So I think I'll start with the easier one, which is just covering the community in that that area, which is that context is not fun, and I think things are better than they used to be in that way, but they're still not everywhere. And I think one of the things that I would do, I mean, obviously this is different. I'm a Black woman, you know, I like everything I do is through that lens, right? But I think just being very humble in approaching your potential sources, and again, you know, go to the library, talk to the librarian, you know, like just talk to people who are not necessarily going to be in the story, and get a sense of who are the players, what's the history, what's the sort of unspoken rift here, or, you know, the backstory on, you know, I mean, I'll never forget, I'm trying to think when this was, I used to live in Bed-Stuy in Brooklyn when I first moved to New York, and it's a Black, or was anyway, I don't think it maybe even still is, but it was mainly a Black area. And at one point the library was closed down, and it was apparently a funding thing, but it was very fraught. And in fact, there were some signs, they had boarded up the door, and there were signs that said, "Open the library, racist." And I was just thinking to myself, wow, I can't imagine, you know, trying to cover that. And I think we might have done a small story on it at the time. But anyway, I think depending, and I can't see you, I don't know your demographic, but, you know, depending on your presentation, I think, you know, you have to come in there humble to both sides. You have to sort of acknowledge that you're an outsider, right? That's hard. And just be like, hey, I'm just trying to tell the story here, and just be really honest about that. Again, get some Sherpas where you can, you know, people who are not going to be the focus of the story, who can just guide you along the way. If you have any networks you can sort of activate. In terms of covering the segregation itself, that's really hard, especially if you're doing kind of a drop-in thing as you are now. It's not like you're moving there and you're getting into the community, right? So I guess I would say, don't bite off more than you can chew on that. Try to do something that's very specific. Make sure you know your stuff. So when you make sure you know all the data, make sure you know all the history, because that's the other thing I was saying, you know, is it's not just about what the sort of status quo is, it's about why is it that way. So make sure you know this, and make sure that you have, that you really have talked to both sides, or all sides, as they say, right? It's not just both, and are willing to represent them all fairly. Doesn't mean you agree with them, but you have to be able to be fair, I think. And, you know, I also just will say that that doesn't mean it'll be easy, or that at the end of the day, you'll think, well, that was great. You know, it was a great experience. It may be really hard, and it may, you know, kind of break you down, but I think it's a really valuable experience, especially as a young journalist.
Awesome. We've got time for maybe one more in-depth question. And you've alluded to this a lot, but Gary Howard wanted to see if you could share your journey to success.
To success? Yeah. That's all subjective, isn't it? Okay, well, so I'll give you the overview. I gave you kind of the flyover before, but so I went to Florida A&M University. I majored in journalism, and I thought I was going to be a reporter or maybe an op-ed writer. And then maybe a year in, I was a reporter at the school paper. Somebody sort of needed help with editing, and they said, "Hey, Nicole, can you help me with this?" And I started doing it, and I just loved it. I mean, wow, I was just totally in love with editing, and specifically at this point, it was copy editing. And because I came in, I was one of those seniors who did like AP credits and stuff, so I came in almost a year ahead. So So when I took the test, the editing test for the Dow Jones News Fund, I was actually, I think I was a sophomore. I took the test. So I think I was 20 when I went to the New York Times. But I had one internship before that as a reporter / copy editor at the Lexington Herald Leader, which is also a great paper. That was my first internship. So then I went to the Times, and I don't know. I mean, it was a formative experience. I can't really put it any other way. It was the kind of place where no matter what you do, there's excellence all around you. There's an expectation that you're doing your best. There is there are the resources to do what you want to do, right? And so I think having that experience early on as a journalist set my bar pretty high. So when I graduated, I ended up actually taking a copy editing job at what is now the Tampa Bay Times. It was the St. Petersburg Times at the time, and was a completely different experience. I mean, tiny copy desk. We had 8 or 9 zones, so you're just shoveling. I mean, I got to do some good editing, but it was not the get 2 or 3 stories a night and really make them wonderful. It was the like, okay, next. And that taught me a lot too, about deadlines, about trimming. Let me tell you, I can trim. People come to me at work because they know that I can do that. I'm like, yeah, that paper was about half too long. So it's something that stays with me, but I yearned for that editing that I was doing at the Times. And so I did go back after a year. And from there, it was really more of a personal decision to leave journalism. I had been promoted a couple of times from being a copy editor to being the deputy slot, which is I don't know if that even exists anymore, but it did then. The slot is the boss of the copy editors. You check their work, you assign them stories. So managing, 20, 25 people or so on the Metro desk, wow, that just seems crazy now. On the Metro copy desk, there were 20 people. And now there is no copy desk. It's just insane. And then I got promoted to assistant Metro editor and was actually overseeing reporters. So at that point in my life, just to be very frank, I was my late 20s, and I was like, I kind of want to have a family, and I'm working, crazy hours. And so I just thought, and also there was part of me too that thought, rather than sort of reporting on the news, I want to get closer. And so all the nonprofit or all the communications I've done has been nonprofit communications. I didn't, go join PR Central. So I sort of wanted to be closer to the change. And that's when I jumped over to communications. And really, since then, I've tried to do things that I felt good about, both in terms of what I was actually doing day to day. So like my first communications job, I was the whole department. So I was doing everything from writing op-eds to coding the web page to producing publications, to, now I have a team of like 15 people. And my job is more strategy and air traffic control, right? Like, so I say, well, here's the plan. Now you go do this, you go do this, you go do this. But I'm not doing as much of the sort of day-to-day stuff. But, I went from helping people with disabilities and people with criminal records and HIV and AIDS, and, to trying to win marriage equality, which was close to my heart because, very long story short, I'm married to a white man, and his father actually is gay. And so this idea of, 50 years ago, the person I'm married to, I couldn't be married to, right? Really hit home for me. And it was really important for me to work there and to, just be one of the allies in the room. And that was some of the most just touching work that I ever did, I think. Then I got stolen away by ProPublica, which was close to my heart because journalism. So I got to do a little bit of both there. And then again, just lifestyle. I just, we were moving to Princeton, had 2 kids at that point. I think I just had my second child at ProPublica. And I was like, this is a bit much, like commuting to New York City every day, like 2 hours one way. I'm nursing. I never see my kids. It was just really hard. So that was really what pushed me to look elsewhere. And I had actually had my eye on RWJF because of the health aspect and, everything I'd been through with my preemies. I was just very interested in this idea of health equity and social determinants. So here I am. It's been 5 years I've been here. That's the longest I've been anywhere since the Times. So kind of weird. I skipped around a little bit for a while. And like I said, I mean, I've been approached about journalism jobs. I've been approached by the Times, you know, and it's still very attractive to me. But I think right now, for me, I'm doing really important work and getting out there stories that are really important and actually helping journalists in a lot of ways, including this. This is a great opportunity to speak to you all and to even make sure that programs like this and the high school program as well, like that they keep going. So again, lived experience, you know, at the foundation, me going to them and saying, hey guys, you have me here because of this program. So can you give us some money? Can you help us out here? You know, like that helps. So who knows where I'll be in 10 years, but I think, like I said before, the thing that's really apparent to me and that's really comforting to me is that those skills don't go away. You use them every day, and you know, you got to keep certain things sharp, but it's gonna serve you.
Well, I certainly appreciate all that you have given us today and your enthusiasm. But let me, we've got to get back to editing stories. You know the deadline pressures that we're under.
I do, yes.
I wanted to turn it back over to Linda Shockley, who also wanted to thank you, and I certainly appreciate your day.
I really want to thank Nicole for this presentation today, and also for the support of Robert Wood Johnson Foundation across the board, and also being there as an alumni advisor and mentor to so many students, and somebody who's advocating for folks to really do well. And if there's anything that you take away from this, besides the expertise in the area of information that she gave us, is to be passionate and committed about what you're doing. This is good work, and it'll serve you well, and it'll serve the greater community too. So thanks so much.
Thank you all very much.
Thank you. Thanks, everyone. Thanks
for having
me.
Back to class.
Bye-bye.
Back to class, everyone.